Nearly 300 million people worldwide are suffering a silent epidemic. It's called fatty liver disease. Almost 1 in every 3 attempt has it. And the scariest part, you feel totally fine. No pain, no warning sign, no symptoms. Until it's too late. So every time you eat food, especially sugar, refined carbohydrate, and ultra-processed food, your body breaks it down into simple sugar like glucose. As glucose enters the blood, body releases a hormone called insulin. It tells your body use the glucose and store the excess glucose. At first, extra energy is stored as glycogen in the liver and muscle. When glycogen storage becomes full, insulin tells the liver to convert extra glucose into fat. This process is called glycogenesis. That fat is stored inside the liver itself, meant to be used only when food is unavailable and glycogen stores are empty. The real problem begins when excess eating becomes a habit. Normal eating does not mean how much you are used to eating. It means how much energy the body actually burns every day. When excess food continues for months and years, fat keeps accumulating inside the liver, slowly, silently. And that's how fatty liver develops. Another powerful driver most people don't realize is the fructose. Fructose is processed almost entirely by the liver. Most tissues in your body cannot use fructose for energy. So when fructose comes from soft drinks, fruit juices and sugary beverages, it is forced straight into the liver. There excess fructose is rapidly converted into fat. Over time, this overload drives fatty liver disease. This doesn't happen overnight. It develops slowly after years of overload because the human body is one of the most sophisticated creation imaginable. It constantly adapts, it constantly protects you, it absorbs the damage, compensates and keeps you functioning until one day it can't anymore. And by then, the warning is no longer silent. When fat builds up in your liver stops responding properly to insulin. So sugar stays in your blood. Your body releases more insulin to cope up with the sugar. And now, insulin resistance begins, increasing the risk of type 2 diabetes mellitus. At the same time, fatty liver releases inflammatory chemicals into your bloodstream. This damages blood vessels and increases heart attack risk. If it continues, the liver becomes inflamed, scarred, and can end in liver failure or cancer. The liver heals only when insulin falls, and insulin falls only when you stop eating. This is where intermittent fasting changes everything. Intermittent fasting isn't a diet. It's not about what you eat, it's about when you eat them. When you stop eating for long enough, insulin drops, glycogen stores empty, and only then does the liver begin to burn its own fat. This is the moment repair begins. Thank you.